This will be by the Nepal Association of Urological Surgeons on supine suction in mini percutaneous nephrolithotomy. Is this the way forward to modern PCNL? May I now invite one of the chairpersons to introduce the revered speaker.
Now may I welcome Dr. Bojraj Luteal. He is one of the strong allies of Sri Lanka Urology, and he is a council member of SLAUS and currently the secretary of NAUS. And yeah, you can, over to you, Boj.
Thank you very much, respected chairpersons, dear delegates, and my friends from Sri Lanka and abroad. A very good morning to you all. So, being part of SARC, Sri Lanka is always a good friend of Nepal, and now we are celebrating 67th anniversary of Nepal-Sri Lanka friendship. So it's a very good time to visit this, the pole of Indian Ocean here. I don't have any conflict of interest. So these are my contents of presentation, why supine suction mini PCNL, and what is our experience from Nepal, and little bit discussion, and then I will be concluding. So in the conventional PCNL, we know that there is active stone removal with forceps, baskets, forceps, and force irrigation. And there are certain issues related to higher intrapelvic pressure, residual stones, longer operating time, dust, and poor vision. And then to circumvent these limitations, suctioning started in PCNL. Why supine position? Because there is conventionally PCNL is done in prone position. We are taught in prone position, and many of the surgeons, if that horse is walking, nobody wants to change the winning horse that you are winning the race. There are additional benefits of supine PCNL with reduced operative time, safer, more convenient from anesthesia point of view, ECIRS, and simultaneous bilateral endoscopic surgery you can do. Better ergonomics for the surgeons, you can do operation in sitting position, and easier access to upper pole from lower pole. You can reach to upper pole in approximately more than 80% of the patients. And best advantage there is gravity drainage as well. Why mini PCNL? We have seen the era of 30 or 32 French PCNL. Everybody has seen all bloody field, everything. But now it has gone to miniaturization to cause the less trauma to the kidney. Less postoperative analgesia, shorter hospital stay and operative time and stone-free rate. And compared when multiplicity and hardness and site of the stone, it has a better thing, because to position from supine to lithotomy to prone position, it takes much longer time. Now, why addition of the suctioning to reduce the renal pelvic pressure, less stone repulsion, improved visual field, no need of accessory devices, and improved stone clearance, and less systemic inflammatory response syndrome, sepsis, and pain. So let's go to the dynamics of the intrapelvic pressure. We know that normally it's somewhere around 10 centimeters of water, and pylovenous or pylolymphatic backflow threshold is 40 centimeters of water if the duration is more than 50 seconds. This is the time the infected stone component, endotoxins, can go to the blood circulation. So if you add suction in PCNL, then that can be reduced to below 10, which is much safer to work, and you can push the boundary of 90 minutes or 2 hours if it is needed for large stones. And in mini PCNL, the pressure can go to more than 36, and in RIRS, that is the highest one, the intrapelvic pressure, it often crosses more than 46 without suction. So what are the suctioning technologies in PCNL? It may be within the scope, in the energy device, or in the seat itself. In the energy device, ultrasonic shock pulse triology, pneumatic lithovac is there, in laser suction platform is also there. In the scope, there is integrated super mini PCNL, manual vacuum cleaner one, and in the seat, single-use peel-away sheath clear Petra or SAS sheath from our neighboring country, India. So this is overview of technologies used in suction PCNL. So we have liberty of in the energy device, and the scope, it's in the scope itself or in the sheath itself. So these principles, Bernoulli's phenomenon principle, combination of vortex effect, Wolfwood effect, vacuum cleaner effect, so many things are there in physics. If you go, I don't want to go in detail. Ultimate effect is that how to make the system dust-free, clot-free, and stone-free. So what are the key tricks of using suctioning in mini PCNL? Optimize suctioning pressure, regulated fluid flow rate, sustain low pressure vacuum pulverization, and subsequent aspiration. Sustain low pressure vacuum is very important. Don't activate the vent throughout. Intermittent is okay, otherwise the sustained pressure, negative pressure will help to release the intrapelvic pressure without sucking out, without sucking out the tissue around. So while using suction, main issue is the standardization of the things are yet to matter, and irrigation flow rate. Still, we should follow the principle of ALARA, like in radiation, as low as reasonably achievable. Maybe somewhere 200, 300, 400, 500, but and suction pressure minus 150 to 300. But I don't want to cross more than 200, because if you go above 200 millimeter of mercury, then there will be rise in intrapelvic pressure due to collapse of the system. And we have to take the scope or sheath near to the stone and to suck out better. So here I want to show you a small video that was running there, but here it's not running anyway. I want to skip, no issue, because everybody does supine suction PCNL. So what is our, oh, it's working from there? Yeah, from there, I think, yeah. So I'd like to move, no problem, because in our hospital, we have done a small RCT to see the trifecta of mini PCNL, what is with the addition of suctioning system. The trifecta is defined as stone-free status without complications and single-session surgery. So in 64 patients were randomized, and the safety, complications, and stone-free status was assessed, and ultimately we could analyze 32 patients in each arm. So at the beginning, the demographic parameters and clinical profile was comparable between both the groups. And stone characteristics were also comparable. Most of them were guys, group 2 and 3. Yeah. So intraoperative parameters, there is more of with suction, there is single calyceal puncture. If you see postoperatively, there is trend towards decrement of fever, sepsis, transfusion rate, and length of hospital stay. Though this is trend towards that, not statistically significant. So postoperative complications also in sepsis, in modified clavin degrading also, that there is trend towards decrement. With larger data, we might have this. Trifecta outcome, if you see that with conventional one, that was just 28%. Because the majority of the groups in our patient, being the referral center, were from guys 2 and 3 more complex stones. And if you add the suction, then it reaches up to 70%, 68.8%. So our study is one of the ongoing RCT and to assess the trifecta outcome. With addition of the suctioning in mini PCNL, there is just trend towards better outcome. It's yet to conclude anything, okay? There is few of the studies showing the effect of suctioning for trifecta outcome. It was initially started by NAUS et al. In non-suctioning setup. They have concluded that in mini PCNL can achieve high rate of trifecta, 84%. They are quite experienced guys, but that is not translating in our center. So Bojraj et al., they have highlighted about this in single arm study in suction addition. Their stone clearance was around 76%. So recent meta-analysis from Jiao et al. That shows that suction PCNL significantly better in terms of less postoperative complications, shorter operative time, less intraoperative bleeding, and postoperative fever. There is no difference in stone clearance and rate and the occurrence of the septic shock if you talk. Another systematic review by Varzilo et al. Also reports that suction has a better outcome and better stone-free rate according to Varzilo et al. So cost analysis issue is one of the issue because whether you go for shock pulse or Clearpetra or other systems, additional cost is there. But overall there is less hospitalization, and that may not be that costly issue. to come to conclusion that suction PCNL is better than the non-suctioning in terms of operative time, perioperative complications, and length of stay and stone period. And supine mini PCNL using suction is safer and more efficacious than mini PCNL using conventional CD in terms of trifecta outcome. And supine suction mini PCNL may be the way forward to modern PCNL, and it's going to hold the future of the modern PCNL. Or rather, it will be the successor of the conventional PCNL. This much I can say at this point. Being the secretary of the society, I would like to welcome all of you to Kathmandu, Nepal in April 4th and 5th for our 10th Eurocon. And this time we'll be hosting along with 4th South Congress as well. Thank you very much.
Thank you, sir. Let me now invite one of the chairpersons to present the token of appreciation and certificate to the speaker.